Hello, today we are going to discuss the Trendelenburg sign. As you may know, the Trendelenburg sign is a test of normal functioning of the gluteus medius. The gluteus medius is the main abductor of the hip, or the main stabilizer, sometimes referred to as the rotator cuff of the hip. So let's go through first what normal functioning Trendelenburg sign would look like, a normal or negative sign. Hannah, can you stand on your right leg? And remember, your hip is a lever, and we have sort of the effort arm, if you remember, on this side, and then on the other side we have the resistance arm, or body weight. Body weight will go straight down here, or really even further. So it relies on the gluteus medius to stabilize, otherwise the opposite hip, or the contralateral hip, will dip down. So right now we go here, and we go here, and we have a straight perpendicular line. That is a normal Trendelenburg sign, representing normal gluteus medius function. Okay, thank you, Hannah. Now let's go to the uncompensated Trendelenburg. So as I said, this is an uncompensated Trendelenburg, and we see how the function of the gluteus medius is insufficient, whether it's neurological, whether it's an injury, a muscle tear, weakness, etc., post-surgical, etc. And so what happens is, we talked about this lever, well, the effort arm, or the gluteus medius, is unable to balance that out. And in not balancing it out, the weight of her body overcomes that, and it drops. And here we have what would be an uncompensated Trendelenburg sign, indicating gluteus medius weakness or dysfunction in some way. Thank you. And the last one we're going to discuss is the compensated Trendelenburg sign. And so with this, we're going to go, and now we have where we still have this weakness here, but instead of the body weight being so far away, Hannah intuitively, and this is an unconscious, intuitive way of compensating for this. So you don't give the instructions, you just have them stand on that leg. And what Hannah's doing is shifting right over her hip joint. And in doing so, she's making the resistance arm zero, or the torque around her hip is zero. And the amount of shifting depends on how far it has to go to eliminate the need for the gluteus medius to function. Thank you. Thank you.